Hi, it's Ed. Welcome to EDTalks. It's a lot of fun doing this because not only am I learning a lot, but it's great to meet these amazing executives that are helping transform healthcare and hearing directly from them and based on the feedback, helping everyone quite a bit who gets the opportunity to listen. So thank you for joining us. We know you have a lot of different options. There's a lot of media out there, all of it good or most of it good. And so I appreciate you being with us. So today we have Dr. Ben Hohmuth. He is the CMIO out at Geisinger. So Ben, welcome to EDTalks.
Thanks, Ed. Thanks. Appreciate the opportunity to talk.
I know when I first got to meet you, and it's only been recent, it's funny because we were pretty close by. You've been at Geisinger for a while, and I was in Cleveland. And so we didn't interact very much. And finally, we had a chance to sit down together. And I was like, dang, where has Ben been? How come I haven't met him before? And so we met over dinner at Becker's, and we just had a great conversation, really connected. And we had some common friends. And so I was like, oh, I want you to be on EDTalks because I think you have a lot to share. But before we get going, we just have a couple questions to get to know you a little bit better, Ben, on a personal side. Tell us about the best customer experience you've recently received. It doesn't have to be healthcare; it could be in any part of life.
Sure. Yeah, I probably like most of us, I do most of my shopping and banking online. And that experience gets better and better, and there's less and less friction. But I might be a little bit old fashioned, but still my best customer experience tends to come at my local hardware store. And it's sort of personal interactions with people who can help. It's a little bit of a less rigid environment. I can go in the back and they can, see if there's some used inventory, and it's just a very personal local experience. And I don't know if that's something my kids will value or not, but to me, that sort of separates it, particularly today where that becomes increasingly rare.
Yeah. So give us an example. Like, what's a recent project like you work? So it sounds like you might do a little bit work around the house or yard or something. What's an example project that you've worked on?
Well, there's a little fish pond with a pump, and I had to sort of rebuild the pump, and it required it's a simple thing, but it required some PVC tubing that needed to be joined and cut down, and just having someone sort of walk me through it and help cut the sections in back. And I had to replace a light fixture as well, needed particularly a new screw for the little casing, and silly small things, but having someone who really provides sort of in-person assistance with both selection and even to the point of sort of getting you what you need that might not be on the shelf, and who has a lot of knowledge and also just a local relationship and community.
Yeah.
It's just different than probably most of our consumer experiences these days. So maybe that's what makes it stand out.
Yeah, no, I get it completely. I can certainly relate. What's one thing your parents sort of forced you to do, Ben, that at the time you're like, oh my gosh, really? And you wanted to rebel or whatever, but today you're glad they sort of forced you.
Yeah. Well, this is sort of funny as it's probably typing, which is a skill that maybe my parents would have said script, and my kids probably will not say typing. I'm pretty sure about that. But for me, it was typing, and it was on a typewriter, and occasionally you had to use a typewriter, and I didn't understand why I was being forced to learn this. And then all of a sudden, keyboards and computers became incredibly prevalent. And, when I went to college, it still would be very rare to own a computer, but there was the computer center. And then, learning how to type efficiently was hugely valuable. Probably not so much going forward, but that's one of many things I would say where my mom had some foresight that I did not.
Yeah, that's good. Was it an IBM Selectric by chance? Yeah, that type.
I don't even remember. I remember I had one that my stepfather was a journalist, and they were it was basically a typewriter, but it remembered like the last sentence, and
Oh,
that was very cutting edge at the time. So he got this because he was they wanted him to promote it, and I got to use that, and it was just cutting edge because instead of the ones where you had to white out if you made a mistake and it was within the past two words, um, you didn't need to break out the
yeah.
whiteout or the little tape that you put under the punch key.
Oh man, you're bringing back a lot of memories. Hey, tell us something about yourself personally, either professionally or personal.
Um, I grew up in Princeton, New Jersey. I went to college, wasn't quite sure what I wanted to do, thought I'd be a teacher. My parents were teachers, majored in physical anthropology. Um, Wound up in medical school because I had a friend who was going to medical school, figured I needed to do something. Um, I guess thematically, I've sort of never known what I wanted to do when I grow up, and I'm not sure that I do any more today than I did then. I've always sort of just sort of availed myself of opportunities based on where I was and the context of the organization, and that's probably a theme that's followed me from secondary school through today.
Yeah, and it seems like you've probably morphed the medical side and the teaching side, right? As a CMIO, I'm sure you've taught a lot of people along the way.
Yeah, I liked the sciences and I liked teaching, and medical school seemed like a way to do that. I got into clinical operations and quality, and increasingly informatics and the electronic health record was a means to an end. And our CIO, who you probably know, Alistair Erskine, at the time, Alistair and I were friends. We had some professional ties, but we also had some personal ties. And he was convincing me to consider, applying for the CMIO position. It wasn't really something that was on my radar or sort of consistent with my vision of where I might want to be in the future. I was very much focused on operations and quality, but I've always tried to do different things, and it'd been a few years since I did something different, and I was ready for a change, but really liked living where I was, really liked working at Geisinger, and so I took him up on his offer, and that was late 2016, and so this is now officially probably the longest I've done one thing, and it's been great.
Yeah, no, that's awesome. And Geisinger has such a great reputation. I know even early in my career, I think it's Glenn Steele. Was it Glenn Steele that was a legendary
Yep.
CEO there? And I remember reading about him and reading about Geisinger. And so as I sort of grew up my career, I always thought a lot and very highly about Geisinger. What's one thing that most people outside of Pennsylvania, and I know Geisinger is more than that, but outside of Pennsylvania, that they may not know about Geisinger?
Yeah. Glenn Steele was our CEO for 15 years, and he was one of the reasons I came here in 2013. Actually, I went back and got my master's degree in 2010, and we recruited him to be our commencement speaker. So, and I read a lot of his articles in Health Affairs, New England Journal, and him and Tom Lee and Al Bothey, and actually my first boss. My very first job out of residency was on the board at Geisinger. So I'd been hearing about Geisinger for a long time. One thing I think there's some confusion about that I hear a lot is two pieces. One is people who don't understand that we have a long-term commitment to integrated delivery. We've had a health plan since the early 70s.
Yeah.
So we've been focused on patients, members, and that intersection of patients and members that we call the sweet spot for over 50 years. Some people don't realize that. And then a lot of people go the other way, and they assume that we're like Kaiser Permanente, where it's more or less, a member is a patient and a patient is a member. But we're really neither. So, on the clinical enterprise side, our hospitals and doctors, about half of our patients are members, meaning that they have our insurance product, but that means the other half aren't. And
Right.
traditionally, that's some sort of fee for service. Increasingly, there's risk sharing, but we've sort of been in that uncomfortable position of having a full foot in both boats, fee for service versus value-based care, for a long time. And so I have that conversation with a lot where people think we're either sort of KP or we're more traditional fee for service, don't realize we have a health plan where we're really right in the middle, which is sort of an interesting place to be.
Yeah, and you mentioned KP, and of course, it was big news earlier this year with the formation of Risient. How does that impact your role as a CMIO?
Well, so in the short term, it doesn't. It's still going through regulatory review, so I can't speak
Yeah.
too much to that. It is a cross-market merger, so hopefully that goes well. But it is a very exciting opportunity. Geisinger is a $7 billion a year organization, which sounded big in the past, but Kaiser's about 94 billion. United, I think, is close to 500 billion. So we're not that big by contemporary standards, and everyone's getting bigger. Everyone, just when you think there can't be more consolidation, there's more consolidation, and there's a lot of margin pressure. So, I assume something will happen, and change is one of the few guarantees. And for that change to involve an organization like Kaiser Permanente and this exciting opportunity that Risent presents is just really exciting for me, and
Yeah.
I think a lot of the folks at Geisinger.
Yeah, I think we all know that we need to do more. Change needs to happen, and doing the same old incremental changes that we've been doing in healthcare is not the long-term solution. So I love it when others out there like Geisinger are, super progressive and trying new things. So it'll be super interesting to watch that unfold. So as I mentioned, we sort of established Geisinger has always been sort of this progressive leader out there. Can you share one example of something, sort of progressive that you are doing at Geisinger?
Sure. So I think we do a lot of things, but historically, where we've done the most interesting things, I think, is in that sweet spot where we provide both care and coverage, and you can do what makes sense. And so, for example, there's been a lot of talk about hospital at home through Medicare. And that's great. And we should move more care into the ambulatory space, and we should provide higher quality care at a lower cost, or at a minimum, the same quality care at a lower cost. Um, when you're providing both care and coverage, you can do that in ways that make sense. And so we have a program called Geisinger at Home for our Geisinger Health Plan members and our Keystone ACO members. That's not built on the Medicare hospital at home. It's simply recognizing that if we can provide the same or better care in a lower cost environment, i.e. the patient's home, let's do that. And let's just figure out the people, process, and the technology to support it. And we don't have to go through a whole list of rules by CMS or otherwise. We can just provide the appropriate care for those sweet spots patients where we can really innovate. So our sort of what we call Geisinger at Home would be one example of that.
Yeah, no, that's good. And yeah, like we mentioned, you all have been sort of leading that wave, and others are looking at what you're doing and following along. And recently in the Annals of Emergency Medicine, there's an article that highlighted some of your organization's work. Can you share a little bit about that?
Yeah, that was Kyle Marshall, who's our associate CMIO. He's a practicing emergency department physician, and he is part of sort of our newer generation of physician informaticians who are practicing clinicians who understand workflow, but are also very savvy on the back end. And just, whether it's Epic or other software, they just get in and do it, which is having those skills of understanding workflow, understanding the front end, understanding the back end are incredibly valuable. Kyle's one of those people. He managed to standardize all 10 of our emergency departments, standardize their workflow. Now, it's a little easier to standardize emergency department workflow relative to inpatient or ambulatory because you have sort of 10 fishbowls, but it's not easy. And over the course of about 3 years, he got all of our emergency departments using the same note template and the same workflows. And there were a lot of benefits to that. One of them is that it allowed him to take advantage of some of the flexibility with the newer evaluation and management guidelines, as well as some new Epic functionality to really decrease the length of the notes. So no longer, pulling in things about history and exam that were really pulled in primarily to justify a level of service, and focusing more on the medical decision making, which was a flexibility based on the new evaluation and management guidelines for coding and getting paid, but also taking advantage of newer Epic functionality to sort of highlight the information that's relevant to clinicians. So stuff that we don't need there anymore, get rid of it altogether, stuff that needs to be there, but may not be what your reader, the consumer of the note, is interested in seeing. When I'm admitting a patient that Kyle saw in the ED, I just want to see his clinical thought process. I don't necessarily need to see other things that are there to satisfy some sort of external regulator. So also the way sort of collapsible sections and really bringing front and center the clinically relevant information is what Kyle did. And it dropped the character count of the notes dramatically, which has some benefit for the author of the note. But another thing that's a little harder to measure is it has a benefit to the consumer of the note, because most people reading notes have to wade through long lists of meaningless information to find that one kernel. What was Kyle thinking? What was his clinical judgment? And so sort of calling that out and making it easy to find, I think, is one of the biggest benefits. And then the notes are just much shorter. And we've done similar work for both inpatient and ambulatory as well.
Yeah, those sort of things are huge. I think we all know, and all of our people that are tuning in with us, that sort of change is really hard. You know, when you talk about 10 different EDs and they've been used to operating a certain way and for many years, and oh man, so that, yeah, big props to you all. That type of standardization is what's very beneficial, as you pointed out, and very hard to do. So many people don't do it. And so it goes back to sort of, you know, Geisinger being somewhat progressive, you know, compared to peers for sure. What's next to tackle? What's one of the big initiatives that you are thinking about? Is there more standardization to do, or is there something else that you're thinking about?
I think probably all of the above. So there's a lot of standardization to do. There's a lot of work to do. There's a lot of road mapping. I think one of the exciting things, and we've managed to get 19 minutes in, I think, without talking about generative AI, but like everyone else, we're excited about rolling out a number of Gen AI use cases, and clinical documentation is one of them. So I think there's going to be a significant focus on that in the next year or two. And then just, you know, trying to do, it's hard to do more with less, but if at least we could do the same with less, because I don't think the pressures on margin are not relenting. And so just continuing to find ways to be more efficient, but still meet the needs of our patients, members, our leaders, and our frontline staff.
Yeah, you know, it's funny you say that. I'm actually at the Healthcare Internet Conference. They don't call it that anymore. They just use the abbreviation HCIC. It's really digital transformation and marketing, sort of focused with some tech. And they made the observation yesterday that last year for the conference there was no Gen AI in any title of sessions. This year it's like 90% of the sessions. So it's kind of interesting. Hey, well, I want to switch over to leadership and ask you this: where do you get ideas? Like, you know, maybe it's while you're at the retail store that you were talking about, and you're working on things on ponds and stuff at home, or, you know, where do you get inspiration from?
Yeah, so I mean, I think it's people like you and you know, your network across the country. I think it's local leadership. But for me, and it may be career limiting, but I'm unwilling to give up my clinical practice. And so I still see patients. You know, I'm on service 6 weeks a year, which is about 20% of my time.
Yeah.
And it is humbling, and it really keeps you grounded, because it's one thing to talk about problems when you're multiple levels removed from the work and then think about solutions. When you're out there on the front lines actually doing the work and talking to other people who are doing the work, some solutions that seem great in a conference room all of a sudden seem not so good. And so for me, a lot of it is really trying to stay connected to that frontline work with the docs, the nurses, the pharmacists, the MAs, you know, at the bedside in the office, and understanding those pain points, because you know, we all see all the time a quote unquote solution that sounds great and looks good, but if it fails that last mile and doesn't meet those workflow needs at the point of care, it tends to predictably not get us where we want to go.
Yeah.
That makes sense.
That's priceless. That makes total sense. What do you love? What's one thing you love most about your role as CMIO?
So for me, it's breadth, right? I like I said early on, I still don't know what I want to do when I grow up. That's probably why I wound up in internal medicine. I had trouble differentiating. And hospital medicine I loved because, I could be in the PACU, I could be, um, you know, taking a patient from the ICU, from the ED, you're all over you touch probably more clinical situations than any other specialty. Um, and for me, informatics is that plus, right? So my work, I talk to frontline nurses, I talk to executive leadership, I'm talk to folks at the health plan, the hospital, the clinic. So you really, IT informatics touches every part of the organization from left to right and top to bottom.
Yeah.
And that's the part I enjoy the most.
Yeah. Yeah, that's cool. Yeah, you're absolutely right. You get the full breadth and depth of the organization. So I think you've already dropped a couple hints as to how you might answer this, Ben. But you're busy. You have children, married, practice, CMIO of a $9 billion health system. How do you recharge your batteries and sort of remain, fresh?
Uh, well, for me, it's being outside and being with family. And if I can do those two things together, even better. A particular passion of mine is backcountry canoeing. So I try and take at least 1 week a year,
Oh,
and there's no cell phone service. And, if you paddle 60 miles in, the only way to get out is 60 miles back the other way. But I usually do a fall trip to Canada. And my middle son is now in 11th grade, and he's started joining me in junior high, which has made it, there's a core group of a couple of guys I go with, and now adding my son to that mix has made it even that much more special. And but for me, it's getting offline, getting outside, and spending time with family.
wow. And how long is your canoe, the main canoe you use on those long trips?
Usually do a 17-foot tandem canoe. If there's just three of us, sometimes we'll do a 19-foot three-person canoe. It partly depends on the terrain. Most of where we go, there's a lot of portaging. So we'll usually do lightweight canoes like Kevlar because you're sort of carrying them from lake to lake and river to river. But actually this winter, Canada canoeing is not really an option in the winter. So we're actually, for the first, I've never tried the Rio Grande. We're going to do the outer canyons of the Rio Grande for an 8-day trip in February, sort of just northwest of Big Bend Park out in these sort of canyons in the desert, which I'm very excited about. And my son will be joining me, so that'll be great.
That is so cool. I can't imagine. I just picture in my mind what the nights are like, right? Because you have no light pollution. It's just you and the stars.
It's that. And the other thing, if you've never done it, that is striking is the noise pollution. To be in a place where the only thing that makes noise is wind and water and occasionally animals. But you forget that just about every waking moment, there's an internal combustion engine. It may be far away, but true quiet is almost impossible to find in most of the places we live. And it's sort of striking when you experience, and you can actually, as dusk falls and the wind dies down, it becomes so quiet, you get a little bit of a buzzing in your ear. And it's one of those things, just first time I've been doing this for over 20 years now, but I remember the first time I experienced it was a little disconcerting. I was probably 20 years old and I just never experienced that before. But then quickly it becomes just really special and unique.
Yeah, wow, that's amazing. Next time we're together, I just want to ask you questions about those sort of trips. I would love that, and plus, that's what keeps you in shape, man. Because that's a lot of rowing, and that's good for your core.
That's true.
Ben, we talked about a lot of things, and it was great. Did I miss anything, or is there anything you want to double down on? I'll sort of give you the last word.
I don't think so. I guess the only thing I would double down on is that one of my reluctances to take Alistair up on this position was thinking I'm not really a tech guy. Like I'm about process operations. Like how could I be effective here? And one of the things I really learned, which probably should have been obvious, but wasn't at the time, was, the vast, this is about people, process, workflow, relationships, influencing decision. There's a tech component, and it's important for me to know what I don't know. And I have some very technical colleagues who I work closely with, but it's really, it's mostly about the people and the workflow, and how tech can support the people.
Yeah.
And I think that's a theme that just, again, keeps surfacing the longer I do this.
Yeah, that's a great reminder. Well, Ben, thank you so much for sharing yourself personally and giving us some insights into Geisinger, and then also sharing sort of your profession and how you think about things as a physician informaticist. So thank you so much for being on EDTalks.